Hi, my name is Dr. Harriet Treacy and I am the co-founder and CEO of BeyondBMI. So I've got 10 plus years experience as a medical doctor across various different areas, but predominantly emergency medicine. And I suppose my inspiration for BeyondBMI really came when I was noticing an increase in the number of people who were presenting with the complications as a result of unmanaged chronic disease. So people coming in with heart attacks as a result of unmanaged heart disease, people coming in with DKA, with diabetic ketoacidosis as a result of unmanaged type 2 diabetes. And it really just made me think, are we doing enough to help people to prevent some of these very, very serious medical conditions and their complications? And what I noticed as well was a lot of these people were living with obesity, and yet very few of them had ever been told how to treat their obesity. They had been told things like eat less, move more, or, calories in, calories out, but they hadn't really received proper medical treatment. And that really became ultimately the inspiration behind BeyondBMI, because we saw this gap for both men and women who were not able or couldn't find the right place to access this non-judgmental care that was actually based in science, that wasn't based in diet culture, and also something that took into consideration the chronic and the long-term nature of obesity, and hence BeyondBMI was born. Yeah, so essentially BeyondBMI is built on the basis of what we call the biopsychosocial model. So the biopsychosocial model is the model that's used across multiple chronic diseases, not just obesity, but it essentially is looking at how do we approach chronic disease management looking through the biological lens. So what are the biological drivers? Maybe things like genetics, things like comorbidities, things like predispositions, family history. Combining that with the social side of things. So what's the environment in which people are living in? We know in America there's things we call food deserts, which reflects your distance from, highly nutritious foods. And then there's the psychological aspect, which is, what are the psychological contributions to chronic disease? And I think it's only through approaching chronic disease with this lens that we can really provide a complete approach to the management of chronic disease, because we are not just, we're not machines that you can just plug one thing in on one side and something else comes out the other side. It's like you have to take into account the complexity of the human experience, and I think that is really what underpins BeyondBMI. So we've taken that model, I suppose, and we've built a team around that model. So we have doctors, we have dietitians, we have health coaches, we have psychologists who attend our multidisciplinary meetings. So all of this allows us to really try and look at people through a more complete and whole lens. Obesity affects both men and women. In fact, I think, there might be some evidence to say it maybe even slightly there's more men living with obesity than there are women, but there are certainly unique challenges that women face, and a lot of them are around things like female health. So things like endometriosis, polycystic ovarian syndrome, fertility is a big thing. We have a lot of people who maybe are struggling to get pregnant, who want to be pregnant, and that they're finding that obesity is playing a part in that. So it's really a privilege in some ways to be able to help people to maybe tackle some of those other challenges they're having through treating the underlying, or at least one of the main, a big contributor to that, such as obesity. So there's quite a few challenges there. And I suppose as well, what we would see is that there seems to be a much stronger emphasis for women, which will come as no surprise, on, appearance. And I think a lot of women find, living with excess weight can be really challenging in that sense, because women seem to be disproportionately judged, more so than men, by having obesity. We want to be a place where women can come to receive trusted, safe, scientific grade information, and to know that when they do join something like Beyond BMI, that they are being supported in the way that they need to be supported, and that their support will be personalised to them as well. The opportunity to meet other women, who are also at a similar stage in their business as I am. I think growing female networks is absolutely key to the ultimate success of female entrepreneurship. Men are very good at having strong networks around them in business areas. We see that with things like chambers of commerce, which typically were very male dominated. And I think women having the opportunity to network more with each other and support each other along the journey is really impactful. So I can see what EIT Bootcamp are trying to do from that perspective, and I think it's a really phenomenal way to engender that kind of peer-to-peer support among other women.